Hi, everybody. I'm Dr. Brosh. I'm a general practitioner, and I've been a medical doctor since 2006. And in the last 9 years, I've been treating mostly TMS patients. TMS is a diagnosis coined by Dr. Sarno, tension myoneural syndrome. The reason why I'm uploading this playlist is to help people who suffer from pain and who think they might have TMS, tension myoneural syndrome, to help clarify issues revolving around this topic, correct common mistakes, common misconceptions, and also help along the path of healing from pain. During the last 9 years, meeting hundreds of people who suffer from chronic pain, I've been asked many questions by patients around the healing from TMS, what it is about, what the common obstacles are, and what one can do in order to progress along the path of healing. So in this playlist, I would like to answer many of these common questions, demystify certain areas in the healing process, and also empower and support the people who are in this process, who try to find a solution to their chronic pain, help them along the way. So I would like to begin with the first, and for me as a medical doctor, the most important thing about TMS, about this diagnosis, is first of all that pain is a symptom. It's not a cause. It's not a disease in itself. And as a symptom, it can accompany many medical diagnoses. So if you suffer from pain, especially chronic pain, the first and most important thing you want to do is get yourself diagnosed. Even with the more common problems such as neck pain, low back pain, and pain in the buttocks and sciatica, we first want to clarify the medical situation. We want to make sure that there's no dangerous thing going on. Of course, we don't want to have any problems run their course undiagnosed, and especially when there are problems that could and should be treated in other measures, in other ways, medically. So, as I said, pain is a symptom, it's not a diagnosis. So the first thing we want to make sure, first thing you want to do is diagnose the pain properly, get to the bottom of the cause of the pain. We mostly want to make sure that there are no dangerous medical diagnoses that are hidden or cause the pain. It could be, for instance, fractures. It could be due to traumas, physical traumas. It could be generalized inflammatory process in the body. And of course, on rare occasions, we could also talk about tumors and malignant diseases. The first thing we want to do, and this is true for each and every case of pain, chronic pain, even when we suspect that there might be an underlying emotional mechanism or brain-based mechanism, we first want to clear this question. We want to make sure there's no other medical entities, no other medical diagnosis that should be checked for. After doing that, then we can speak about the option that the pain is caused by a mechanism that is more benign, that is, of course, reversible, and could be released from through various techniques that work with the mind-body connection. But the first thing we want to make sure is that the diagnosis is being done correctly in a thorough way to rule out more rare and dangerous medical entities. This is a first video. I'm gonna upload videos every week or so. In the videos, I'll cover common questions. I'll cover topics that relate to TMS from a doctor-patient perspective. I hope this will help you on your path to heal from the pain. Before we say goodbye for today, don't forget to check the list of resources I've I put below this video in the description down below. So check out those resources. These are resources that I personally know, books I've read, videos I've watched. There are many other resources, but it will give you a very good beginning and a very good understanding of the basics in what is called TMS. So I hope that this has been helpful, and looking forward to seeing you in the next video.